What is going on, guys? Welcome to another episode of the Mask and Health Solutions podcast, where I am joined by Dr. Judson Brandeis, the author who talked to us last time about the 21st century man. And today we're going to dive more, well, into like the studies that he's done, the P-Long study, which has now been completed, and some of the other things that he's got, basically planned for the future, which I look forward to learning more about. But first and foremost, Dr. Brandeis, how are you today, man?
Oh, I'm doing great. Thank you so much for having me on. I really appreciate it.
Hey, no, thank you, because you're the one that always comes correct. And I mean, I got a million different things that I'd like to ask you. And honestly, I'm kind of giddy when it comes to this conversation because, as I get older, a lot of these things are becoming more relevant, right? And, as we look into TRT, HRT, and some of those things that I'm like, well, I don't necessarily want to jump into that myself right now, but one of the first things that I want to dive into was the P-Long protocol, what it is and the progress that you made. Because last time we talked, it was about 2 years ago. And I just want to know how that kind of played out. How did that all work out in the end?
Yeah, so we did the study kind of through COVID. So it was really tough to get people in and to keep things going. But finally, we got 30 patients to complete the study, which was a 6-month protocol. And the results were really amazing. I mean, they weren't totally unexpected,
Hmm.
given the technologies, but no one really had ever put all that together, put it into a study, got it IRB approved, listed by clinicaltrials.gov, which is the NIH website, published it in a reviewed journal, presented it at the Sexual Medicine Society meeting and the International Society of Sexual Medicine. And so basically we got almost an inch of length, about
Damn.
15% of extra of the initial length, and about 10% increase in girth. And
Wow.
everyone in the study had improved function.
Jeez. I'm pretty sure nobody was sad after the study was done.
No, definitely not.
Oh, that's
And
awesome.
yeah, the great thing is, since I did all of the PRP injections on all the patients, I got to
Mhm.
experience and talk to all the patients every single time they came in. And so I really found that patients were happy,
Yeah.
really satisfied with the results of the study. And so, if I didn't think that overall patients weren't going to be happy with participating in the study and participating in the protocol, I never would have rolled it out on a national
Mhm.
basis. But now we have, I think, 50 or 60 offices around the country that are
Wow.
doing the P-Long protocol.
Dude, that is, yeah, because I mean, as a man, I don't think if you go talk to like 100 guys on the street, I'm pretty sure 98 of us are gonna say, "Yeah, I wouldn't mind if it was longer and bigger and work better." Like it just kind of comes with the territory. Like I was reading on your website too, where you were talking about how, for the most part, most men who are usually average or a little bit above average, yet we still see ourselves in that light of like, I'm not enough. Which I understand, it comes from like the social constructs that we have. However, I think it's a part of being a man as well, where we always want to improve ourselves. Like I go to the gym and I always want to get more ripped, develop more muscle. And in this case, it's kind of like, yeah, I got into like male enhancement just because of that. I want to improve myself. What were some of the modalities that take place in the P-Long study though?
Yeah, I mean, well, first of all, I got into this because I would see guys come to the office that had tried other treatment modalities, whether it was fillers or fat transfers or suspensory ligament ligations
Oh, I saw
or
that one.
placing a silicone implant, and just some of these guys were having total disasters. I mean, that's not
Yeah.
to say everyone that has these procedures ends up with a total disaster, but even if it's 5 or 10%, that's just way too much. I mean, I remember this one patient I had, this 25-year-old male nurse who like had a pretty normal sized penis, good looking guy, and he had had what's called a pneuma implant. It got
Oh,
infected. He was in
oh,
the hospital for a week with antibiotics, had it taken out, had needed 2 additional surgeries to try to fix all the scar tissue. And still, I mean, he's lost about an inch and a half in length, and he's sort
uh,
of permanently emotionally scarred from that whole process. And so, do you really want to take that risk? Or there's another kind of famous study of not study, but a case of this like billionaire who had a fat
remember that.
transfer and ended up with a fat embolism and actually died.
I remember hearing about that on Joe Rogan's podcast and looked into that. Yeah. And I was like,
Like,
what's
so
going
I
on,
mean, do
man?
you want to have people go back to your like 20th high school reunion and like, oh, did you hear what happened to Joe? Like,
I
do
would
you
really
really
want
want to be
that.
that guy
No.
that died from a fat embolism from a
Oh,
penis
jeez.
enhancement procedure? So, I mean,
No.
that's the beautiful thing about the P-Long is it's totally 100% safe. I mean, it's traction, it's suction, it's the Affirm nitric oxide boosting supplement, and it's a PRP injection. So, once a month for 6 months. And so basically, we take your blood, we spin the blood, we get rid of the red cells, we get rid of some of the plasma, we take the activated platelets and re-inject it back into the penis. The way I do it,
Mhm.
using ultrasound guidance, I actually only make one little injection site with a 30 gauge needle. Drawing the blood from the arm typically hurts more than the injection in the penis.
Well, I mean, it's kind of like rest assured. I think it's a little bit safer to go that route than, ending up with a whole bunch of different. Because I remember looking into the suspensory ligament, and I thought, I guess back in the day, like 5, 10 years ago, it seemed like that was the only surgery that really existed. I'd seen some other things out of Korea as well, where they were using like the fat fillers as well. And I'm just like, well, that doesn't really look like they got it just right. I don't know if you listen to George Carlin at all, but he had this joke
Yeah.
about breast implants. He's like, well, if I were you, I'd wait 20 years down the road because right now they look all kinds of fucked up. It's kind of true. You're right. Now they've kind of mastered it to the point where it's just something common, right? And I think what you've done too is revolutionize our perception, or I guess the way that we look at male enhancement now, because it's kind of like, well, it's safe, it's effective, and one of the major keys that you mentioned there as well is that the functionality side of it is still there, and it's actually working better, which I think with a lot of those other surgeries, I mean, I don't want to end up on botched.
Yeah, definitely not. But the other thing is, and I'm sort of projecting from the female perspective. A lot of women are interested in sort of guys' self-confidence.
Yeah.
And if you come into the bedroom with a big piece of silicone in your penis or a bunch of fillers in your penis, like even though it might make your penis a little bit bigger, it makes your stature and your sort of ego a little bit smaller. And I think women are looking for that sort of stature and ego as much as the size of the penis. And so, um, if you can do something like the P-long, which
Mm-hmm.
increases length, girth, and function, but you have a totally natural, normal appearing penis, it's just bigger and better. I think that plays more into the self-confidence factor than getting something synthetic or artificial put in there.
Yeah, and I mean the thing about having something synthetic put in there is that you never know how your body's gonna react to it. And I think it kind of looks weird too, because that I've seen some of it and it almost looks like the vascularity's gone. It kind of looks like a big smooth like dildo-ish type dick, where I'm just like, that looks kind of odd. It doesn't really look like it belongs to you. It's almost like something foreign inside of the body
Yeah,
is now there. It almost looks like a plastic, I don't know, contraption's been added to your dick, which I think is kind of just odd looking, right?
yeah.
But there was one thing I wanted to ask you about the P-Long study. I wanted to know about one of your favorite clients that kind of went in there, got the P-Long, what his initial, like, how did his whole situation just kind of come about with, like, let's say his wife, and how everything changed after the study? Because I'd be really interested into like that side of things. I always like hearing the anecdotes, man.
Yeah, I mean, guys just have like a better outlook on physical intimacy. They're more confident going into the bedroom, and that I think reflects with their partners as well.
Hmm.
Um, so, and I think the functionality also is an important part of it. So when you look at PRP, there have been, I think, 4 studies on the benefits of PRP. 2 of the studies looked with 3 injections. One study looked at 2 injections, and those were positive outcomes. And then one study out of the University of Miami looked at, I think, either 2 or 3 injections, and the what's called the SHIM score, which is
Okay.
a measure it's a questionnaire that measures erectile function, went up 3 points in the injection group, but it also went up 3 points in the placebo group. And so their conclusion was, well, it didn't work. But they never really explained why it went up in the placebo group. And so I think across the board, studies that look at the use of PRP in the penis have shown some benefit, but we're doing it once a month for 6 months.
Yeah. Yeah, and I think, well, the P shot's something that's being used more and more. And it's not just, I mean, I first heard about it for a guy who was actually treating his hair loss, which I found kind of interesting. I'm like, and
Mhm.
then during the conversation I had with you, you were like, well, no, the P shot's actually, I'm using it for the penis. I'm like, wait, hold on. There's more to this science than it feels like it just needs to be explored more to be fully understood.
Right. Well, it's just, it's platelets, and platelets have two functions in the body. One function is to cause a clot, but the other function is to trigger regrowth. So anywhere in your body that you need a clot, there's the assumption that there's some sort of damage. And
Hmm.
so the good Lord created this amazing system where you deliver clotting factors, but then you also deliver growth factors to help that tissue heal and regrow. And so we're just taking advantage of the fact that there's a massive amount of growth factors in platelets and then just delivering it into the penis. Now, you could also deliver it into hair follicles. You can
Yeah,
also deliver it into joints, and a lot of orthopedists use PRP to help stimulate the growth of collagen and elastin. A lot of dentists use it to help with gum growth. A lot of wound healing doctors use it to
interesting.
help wound healing. So it's a very non-specific group of growth factors that is autologous, meaning it's from you, right? So you're
Interesting.
not getting it from somebody's placenta, you're not getting it from a cell line, you're not getting it from any other source except from your own body.
Interesting. Well, that way the body doesn't reject it. Back to your point about
Exactly.
functionality, right? It's kind of like, well, no, this came from me. Therefore, I know that it's mine and it's not something I'm going to reject. The other question I had too in regards to the P-Long study, did you use Gainswave technology along with the P shots or?
No, when you're doing a study like this, you want to limit the number of variables.
Okay.
And so, I thought about it. I mean, I thought about using low intensity shockwave therapy and a number of other treatment modalities. But at the end of the day, you want to see what actually kind of works. And so I think the combination of traction and suction helps pull the penis in length, pull the penis in girth. The nitric oxide boosting supplement improves circulation in general and helps with nighttime erections. And I can talk to you about a really cool study I'm doing now on that.
Yeah.
And then the PRP kind of makes it go faster because it's introducing growth factors. And the other cool thing is, the study was 6 months, but I have patients who participated in the study and then continued on month 7, month 8, month 9, month 10, and they're continuing to get growth. So, you know, 15% at 6 months is kind of average.
Hmm.
But if a
Wow.
guy is interested in 25%, it just means that they have to continue doing it.
Yeah, I think everybody is. As soon as you see 50%, I wouldn't want to stop. I'm like, let's see if we get to 50%. But yeah,
Well,
tell
I had
them.
one patient who stopped, and I asked him, I was like, how come you're stopping? He's like, well, my wife says I'm too big for anal and I'm too big for oral, and you know what? I got to keep at least one orifice open.
Well, it's a great problem to have. I mean, I
Yeah.
bet she's happy though. I mean, again, it's kind of one of those things that he's suffering from success. So, hey, you could just chuck it over his shoulder and he'll be all right. But tell us more about the other study you're working on as well.
Yeah, this is a really interesting study. So there's a device called the FermTech ring.
Oh yeah,
And
dude. Yeah, talk to Dr. Elliot, right?
yeah, and so he and I are working together. And basically it's a Bluetooth device that it's a ring that you put around the penis that measures penile pressures.
Yeah.
And it tells you how many erections you're getting at night. And so, I came up with the Affirm supplement, which is a combination of citrulline, which is a non-essential amino acid that your body turns into arginine, which then releases nitric oxide.
Hmm.
And then it also has nitrates or beets, which then get converted into nitrites, which then get converted into nitric oxide. And so in your body, I'll go a little biochemical on you.
Yeah.
Uh, Nitric oxide causes the release of something called cyclic GMP. And
Hmm.
cyclic GMP then creates a cascade that opens up blood vessels. So the more cyclic GMP you have, the more your blood vessels open. And so a lot of bodybuilders and elite endurance athletes
Yeah.
take advantage of boosting nitric oxide to increase blood flow to muscles. I know in my own patient population, guys in their 60s and 70s all tell me that they think more clearly because they're getting better brain blood flow. I take a
Mhm.
lot of guys off their blood pressure medications because the vasodilation, the opening up of blood vessels naturally decreases blood pressure, and you can use it to help improve genital circulation, especially at night. That's why I use it with the P-Long is I want guys to get better nighttime erections. But it was kind of important for me to prove that. And I met uh, Justin Elliott at the Sexual Medicine Society of North America meeting, and we designed this study. And so the first 2 days of the study, you just put the ring on, but you don't take the Affirm nitric oxide booster. And
Interesting.
so guys were getting, their typical nighttime erections. And then the next 2 nights of the study, guys were taking 2 Affirm tablets. And what we noticed, I mean, we haven't tabulated the full results, but even on myself, because I did the study, is I noticed significantly better nighttime erections.
Interesting.
And the interesting thing about nighttime erections is they're not really affected by any sort of social interaction. So I
Yeah.
remember I had this one patient who was like, "Oh man, doc, it was like $100 down the drain." And I was like, "What do you mean?" He's like, "Well, I took my wife out to dinner, really nice dinner, got a really good bottle of wine. I loaded up on Viagra. And then I said one stupid ass thing, and it was like $100 down the drain."
Oh, it sucks, man.
Yeah. And so, that's not affected by nighttime erections.
Yeah.
Nighttime erections, they just happen naturally. So it's a good way to determine sort of purely physiologic erectile function.
Interesting. And that's the thing too with the Firm Tech ring, because yeah, I mean, Dr. Elliott hooked me up, man. And like honestly, it's crazy that you can just kind of track that too. And the one thing that we always kind of knew in the male enhancement penis enlargement kind of side of things, like what we read on forums, it's like nocturnal erections are important because it shows that, you know what, like you're still functioning. And the thing is, it's kind of like that recovery side of things is one of the things that we'd pay attention to, but there's no way to track it in a granular kind of
Hmm.
way, right? Whereas now it's like you have real-time data in the same way I track my macronutrients. It's like, dude, I can know like my stats. It's kind of like it's like a Fitbit for your dick,
Yeah.
essentially. So,
Yeah. Yeah. It really is. I
and
mean,
it proves the validity of the Affirm supplement. Tell us more about the Affirm supplement itself and like what you got. Like, what are some of the things? Because you mentioned beets and stuff that you have inside of it. How does it work, and what are some of the ingredients?
yeah. So it's citrulline. A lot of people take arginine, but the problem is arginine is that it doesn't get absorbed well by the GI tract,
Yeah.
and it decreases your blood pressure in kind of a bad way. And so a much better way to do it is to take citrulline,
Mhm.
and then your kidney turns citrulline into arginine, and then arginine releases nitric oxide and then gets cycled back into citrulline. So, and in your body, you get half of your nitric oxide from the citrulline arginine pathway, but you get also half of your nitric oxide from the nitrate, nitrite, nitric oxide pathway. And so foods like beets and deep green leafy vegetables are high in nitrates, which then get converted to nitrites and which get converted to nitric oxide. So it was important for me when I was formulating the supplement to have both pathways present.
Interesting.
And then
Yeah.
also a little bit of ginseng, a little bit of murepuama. And then the other nice thing about Affirm is that it doesn't have all these filler ingredients. You look at a
Mhm.
lot of these vitamins and nitric oxide boosting supplements, and they have like vitamin C, vitamin E, vitamin D. Like, take a multivitamin. Right? If you want to do that, just take a multivitamin. Like, if I'm going to pay for a nitric oxide boosting supplement, I just want just the nitric
Yeah.
oxide boosting supplement, and so that's what we did with Affirm.
That's the beauty of it. I mean, it's kind of one of those things when you scale things back and you kind of look for the foundational side of whatever it is that you're taking or you're working on. It's always the basics, right? And the rest of it's just kind of like, why are you adding vitamin C, vitamin D, vitamin
Yeah.
whatever? It's just like,
It was
then they'll
funny. I
put
went to
something
Costco the
sexy.
other day, and they're like, Costco brain supplement, vitamin A, vitamin B, vitamin C, vitamin D. And
A
then
multivitamin.
you go to the next, like Costco weight loss supplement, vitamin A, vitamin B, vitamin C.
Oh
It
my
was like
gosh.
basically the same thing, just different labels. So,
Yeah.
with the Affirm supplement, it's just purely nitric oxide boosting ingredients. And it's, compared to the other branded supplements, it's very, very, very reasonably priced.
Yeah, without the marketing, because that's kind of the big thing that sets certain supplements apart, I find, is just like, you know what, this one's uber sexy with sexy people on top. And you're like, oh man, I got to get the hardwood 5000 with some dude with some
Yeah.
massive
Are you
schlong.
saying
It's
that
like,
I'm not sexy?
I think you're sexy, man. But if you need a model, I'm here now. Wait, post show, we'll take pictures. I don't know if my wife would approve me with my dick out, but we'll see how it plays out. But the other question I had for you too, in the P-Long study, you mentioned an extender. What kind of device did you guys use?
Yeah, we used something called the Restore X. So
Okay,
it's a device developed by a friend of mine at the Mayo Clinic, and the data, the studies they did really on this device were incredible. So it
interesting.
was primarily developed for Peyronie's disease, which is a
Yeah, that's what I
acquired
read about.
curvature of the penis. And what they found was guys got 1.7 centimeters of increased length when they used the Restore X plus something called Xiaflex, which is a collagenase. It's an enzyme that dissolves the plaque.
Oh, what?
Uh, but when they compared just the Xiaflex, Xiaflex plus a different traction device, and Xiaflex plus the RestoreX. And so Xiaflex alone and Xiaflex plus the other traction device did not have any increase in length, and Xiaflex plus the RestoreX resulted in 1.7 centimeters in length.
Interesting. And
Yeah,
how was
and
the
so
functionality after it?
I mean, there's not just stretching it, you're not generating any increase in function. You're
Okay,
just generating an increase in length.
Roger that.
And so
All
that's
right.
the nice thing about the P-Long is you kind of get a little bit of everything. You get length, you get girth, you get function.
Yeah, and then for girth as well, did you use a pump or anything, or?
Yeah, we use a Dr. Joel Kaplan penis pump.
Oh, nice. The Cadillac of pumps. I mean, I've
Yeah,
seen those.
exactly. Exactly.
Those are great devices. And how long, what did it look like when they would pump as well? Was it like broken down in sets of 10 minutes, 15 minutes? How did that kind
Yeah,
of look?
so it was 1 minute release, 1 minute release, 5 minutes release, 5 minutes release. So
Okay.
and that just has to do with the way that collagen fibers slide alongside each other. It's like when I wake up in the morning and I want to stretch, like first I touch my knees, then I stand up, then I touch my shins, then I stand up, then I touch my ankles, then I stand up, then I touch my toes. It's like I
Gotcha.
can't just go
Yeah.
straight and touch my toes.
Yeah. Gotcha. No, but that's super interesting because that just means you've broken it. It's almost like a workout is the way I kind of see it in my mind. It's like you got the supplements, you got the different workouts, and then obviously you go in for the shot. And the shot was once a month, if I'm not mistaken, right?
Yeah, once a month for 6 months.
And then how would you kind of just look at their would they take pictures or how would you just kind of gauge their
Yeah, I
improvements?
mean they would take pictures. The thing is a lot of studies use what's called stretch penile length. So you come into the doctor pulls on your penis and then measures it. But the thing is like you could cheat on that, right? Like on day
Yeah,
one, I would pull just a little bit. And on day six, I would, pull a lot and say, well, look, you grew up, an inch. This way guys get erections at home. We gave them standardized measuring instruments, and they just took pictures.
interesting.
And so, my inbox is flooded with dick pics, but
Well, now you know what it's like to be a female porn star, I guess.
yeah, there you go. If the Russians ever hacked into my inbox, they'd be appalled.
They'd be like, "What's going on here in the United States? This guy's got a
Exactly.
freaky fetish over here." Be a great way to look at it. But tell me more about the Mancella study as well, the Mancella 2, if I'm not
Yeah,
mistaken.
so that's a really amazing piece of technology by a company called BTL, and it uses what's called HIFEM, high intensity focused electromagnetic waves. And so, a lot of people use TENS devices, which are direct current. So direct current is you take the path of least resistance between point A and point B. But this uses a 2 Tesla magnet, creates an electromagnetic field that contracts muscle.
Okay.
And so we did one treatment a week for 10 weeks. It's really, unless you're actually on the machine, it's very hard to conceptualize what it's like but it's, if anyone's ever heard of a Kegel exercise, it's
Oh yeah.
contracting the pelvic floor muscles. But this does it, 20-fold more intensely than you could ever do on your own for
Mm,
30 minutes. And
jeez.
so it strengthens a couple of muscles. One is what's called the bulbocavernosus and the ischiocavernosus muscles. Those are your ejaculation muscles. And so guys were saying that they were getting better ejaculations. That also strengthens the pelvic floor. And so I use it for patients who have incontinence. So urinary leakage,
Yeah.
like after prostate surgery and those sort of things. And then also it improved erectile function, not
Interesting.
to a massive extent, but I think it's really another treatment modality in addition to low intensity shockwave therapy and Botox and Viagra and Affirm or nitric oxide booster. Just one more thing that we can add to improve function, and it also improved urinary flow. And
Interesting.
so I think I'm trying to get some universities to actually begin to look at using this to improve urinary function in men whose bladders are starting to get weak.
Interesting. So this is, are you using it primarily for older males, I guess, who are suffering more from the incontinence side of things, or just it's available for anybody?
It's kind of available for everyone. So, guys that want to have more intense ejaculation
That's me.
works great for that.
Yeah.
Um, for older guys that are having trouble urinating works great for that. Guys that have urinary leakage works great for that. So, um,
So if a
yeah.
guy does that, then would you still recommend having or doing Kegels even? Because it's kind of like, if
No,
you're already
well, I
strengthening
mean,
muscle.
you 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 know, you could do this every week for the rest of your life, I guess. But if that's an issue for you, Kegels are pretty straightforward and easy to do. There's no downside of doing them.
Interesting. Yeah, I mean, because it's something that I've heard about before, but I mean, there was a time where I started doing Kegels, but I did a little bit too many and I gave myself like premature ejaculation. So I was like, well, this
Mm,
is overkill. But I think I got into the point where I guess I fatigued like the PC and the BC muscles. So I was like,
yeah.
it's a little bit too much.
Yeah. The thing is, it's a difficult muscle to identify and a difficult muscle to strengthen. Biceps easy. You
Oh
put a
yeah.
weight in your arm and do that. But pelvic floor is actually a combination of about 8 to 10 muscles, and it's coordinating all those muscles into a sustained contraction that's really tough.
Yeah. I mean, that's where you come in and kind of help us not dissect it, that's the wrong word to use, but where we can kind of just pinpoint the right muscles and obviously kind of target them correctly. The
Hmm.
other thing that I had a question about, I believe it was the surge study. Is that the one with the topical cream that you were using as a way
Yeah,
to
that was an interesting study. It worked in about 50% of folks.
interesting?
Um, the company came to me and they said, we basically have a topical Viagra. And I said, well, that sounds too good to be true because, anytime anything you put in the skin of the penis has to go through the skin, and the skin is a very impenetrable barrier, right? If you think about water is H2O. It's a really small molecule,
Hmm.
right? If you're in a swimming pool, you don't get waterlogged,
No.
right? Because your skin keeps the water out of your body. So anything you put on the skin of the penis has to go through the skin, through the subcutaneous tissue, and then the tunica that lines the erectile body is a really thick tissue, right? So I mean, I've opened people up and opened up their aortas, which is the biggest blood vessel on your
Oh,
body, and the tunica of the penis is thicker than the wall of your aorta.
jeez.
So, in order to get something through the skin, through the subcutaneous tissue, and then through the tunica of the penis into the spongy tissue of the corpora cavernosa, that's a that's a tough ask.
Yeah.
And so, this product called Ovask actually did it to a certain extent, but not in a high enough percentage of my patients where I thought it would be a commercially viable product. And, they wanted to give me like a percentage of the company and all that stuff. And I said, before I do anything, I want to do a study because I'm not going to put my name and behind a product that doesn't seem to work. It doesn't work in a high enough percentage of people. That's just not like who I am.
Yeah. The other question I had, because you said that I worked for 50% of the people that were using it. What do you think was missing from it, or how would you go about improving it then?
Well, I mean, it's the ability to get the penetration through the
Okay.
skin, subcutaneous tissue, and through the tunica. I think that's the trouble with any of these things. There's a new product out called Eroxon, which kind of has a similar principle, but it's almost, as best I can tell, like putting rubbing alcohol on it.
Yeah.
It causes blood flow from internal to kind of go towards the outside.
Mhm.
Um, and that I have a couple patients who have ordered it from Europe and have had sort of somewhat limited success with it.
Interesting. Your rocks on. It sounds like a Pokemon or something.
Yeah.
And then the other
I'll trade you
question.
I'll trade you my Pikachu for your Eroxon.
It's like, oh man, go up to the kids. I mean, I don't know. My son would probably be pissed off. Like, what do I do with this?
Yeah, exactly.
So he goes to school, shows his friends. Man, I'd probably get all kinds of
What's the
shit.
superpower?
Yeah, he has a boner the whole time. It's like, oh gosh, man, run away from all the girls running from him. I don't know, that'd be bad. And the other one that I had, I believe it was the swap study as well that you were working on.
Yeah, that was the Shockwave for Peyronie's disease study, and that was a casualty of COVID. You know,
COVID.
it's it was just hard to keep these studies going through COVID. People wouldn't come to the office.
Yeah, well, I mean, COVID was one of those things that just kind of rocked this world for a couple of years, and it's weird though because it seems like everybody just forgot. Like where we're at
Yeah, well,
now,
I
it's
think
like,
everyone wanted to forget. I
yeah,
think
it's like
that I think a lot of us still have kind of the scars of COVID, but
just trying to remember like all of it. I'm like, well, you know what? And don't got to wear no mask, all that kind of stuff got disproved, and here we are, a couple of years later, like nothing happened.
yeah, I mean, my older daughter kind of lost the last 2 years of her high school experience,
Yeah,
and
dude.
can never get that back.
No, especially when you're like prom and all that, which is just, I mean, it's brutal. But the other thing I was gonna dive into now is just Gainswave and vibrational technology. Like, what's your take on it? How do you like it? How do you go about using it in your practice, if you do?
Yeah, so I mean, Gainswave is just a marketing term for low intensity shockwave therapy.
Gotcha.
And then there's two real forms of wave therapy. One is what's called radial wave. And you can think of radial wave as like if you have a smooth pond and you drop a pebble into the pond, the
Hmm.
waves kind of ripple out from that. And then the
Gotcha.
other is a focused wave. And that means that the waves start from wide and then narrow to a specific point. And
Gotcha.
then, not to go into deep physics with you, but if you look at a sound wave has a kind of gentle sinusoidal waveform. A a radial pulsed wave has a high peak and a sharp drop,
Yeah.
and a true focused wave has an even higher, more intense peak and an even sharper drop. And when your body experiences either a radial pressure wave or a true shock wave, it experiences it as an injury, right?
Gotcha.
And so even though nothing is being injured, your body experiences that as an injury. And so it generates an injury response. And that injury response does a couple of things. One is it causes the release of growth factors,
Hmm.
especially vascular growth factors. And the other thing is it causes activation of stem cells. And stem cells are cells that can grow into other cells, right? So we have
Yeah.
stem cells all around our body that help replenish the the um, the tissues in our body. So
Yeah.
like in gastrointestinal tracts, is constantly being replaced by cells, and so you have a lot of stem cells in there. Other parts of your body, like your heart or your kidneys, that don't grow all that much, they don't have a lot of stem cells. And so in blood vessels or around blood vessels, you do have a fair amount of stem cells. And if you stimulate those stem cells by tricking your body into thinking that there's an injury, you can grow new blood vessels.
Interesting. And that's kind of how it plays into it, I guess, with the sound wave technology.
Exactly. And so, there's only been two studies that looked at radial versus focused, and there was a fair amount of equivalence. But most of the studies that have been done on wave therapy have been done on focused wave therapy. And there's one study on radio wave therapy out of Colombia, the country,
Hmm.
that was a pretty well done study that looked at radio wave and didn't show much of an improvement. So, there's still debate in the academic community, even if it works,
Yeah.
and who are the best patients that are best suited for it, and then whether focused is actually better than radio wave or not.
Interesting. So it's kind of like it depends on the candidate as well, which is, I guess, something that I overlooked because I was just like, oh, anybody could take it, but that makes good sense.
Yeah, definitely.
Interesting. And I mean, another question that I had, just overall health for guys who are just looking to maintain good erectile health, like let's say like for myself and a lot of guys listening to the show, a lot of us are between the age from like 25 to 50, right? Maybe we don't have any issues that we know of, but we just want to make sure we can maximize. Some guys get into it for the male enhancement side of things. But what's like a basic protocol slash supplements that, a guy like me could take to just make sure, I stay optimized pretty much for as long as I can?
Yeah. Well, I mean, the best thing to do is just maximize your cardiovascular health.
Roger that.
So make sure your cholesterol is not too high. Make sure you're not eating a lot of foods that'll clog your arteries. Make sure you're not smoking. Make sure you're not drinking too much. And then get your ass off the couch and exercise, and cardiovascular exercise, whether it's biking, running, swimming, rowing, basketball, something to get your cardiovascular system flowing. Because the thing is, the penis is like the only organ in the body that moves entirely based on blood flow.
Yeah.
And so if you don't have adequate blood flow, in order to generate enough blood pressure in your penis to block the return of venous blood back into your system, then it's not going to work. And so, any pill or any supplement or any of those kind of things isn't necessarily going to help you. The cheapest and easiest and best thing to do is to get yourself into good cardiovascular fitness. Now, we don't last forever. And so there are things that you can do. And so the first tier intervention that I recommend is just a nitric oxide boosting supplement like Affirm, which
Mhm.
naturally increases blood flow everywhere in your body, including the penis, right? And
Yeah.
there's no side effects from nitric oxide boosters, right? It's
Yeah.
all benefit. I mean, how many things in life are all benefit? Um,
Not a lot.
yeah. Now the next tier are PDE5 inhibitors like Viagra, Cialis, Tadalafil. The
Yeah.
great thing is they're generic, right? So they're cheap. Like in my office, we sell a Viagra for $1 a pill, Cialis for $1 a pill. I mean, it's amazing. And the great thing is these are very safe medications, right? So, I mean, there have been studies on Cialis for improving urinary function. So it's FDA approved for urinary function. In
Interesting. I
addition,
didn't know.
it's been shown to decrease the risk of dementia and
All
improve the reduce your risk of heart disease, heart attacks, and those kind of things. And the way that it does it is it's a vasodilator. It opens up blood vessels. You'd be much better off taking a nitric oxide booster because that's more nonspecific, whereas PDE5 inhibitors are specific to the penis but have some peripheral side effects.
interesting. So, I mean, could you even see or use it as a nootropic almost because it improves like brain function as well? I mean, well,
You could,
not
but
for the
like I said, you can be
PD5,
much better off just using a nitric
nitric
oxide
oxide.
booster,
Yeah.
which is, has kind of broader beneficial effects, whereas a PDE5 inhibitor is much more specific to the penis.
Yeah, because bodybuilders, I mean, that's kind of where, I mean, the first time I ever took Cialis wasn't even, to get down and have a good time. It was more to go to the gym, and my buddy's like, oh, just take it, you'll get a wicked pump. And I remember taking it. I'm just like, oh, wow, this is like, it was intense. It was one of the most intense pumps I've ever had in my life. But at the same time, I was like, this is weird because it's supposed to be for my dick. Like, what? But then I'm at the same time, like, well, it improves blood flow. I'm pretty
Yeah,
sure,
you made me think of a case that I had when I was a resident in Los Angeles. Some guy was in the gym and he thought it would be a good idea to uh, pleasure himself with one of those rings that you put around on a weight bar
oh my
to keep
God,
the weights
why?
on the. And then he ended up getting stuck,
Oh.
and we ended up having to call the fire department into the into the hospital because they were the
What?
only people that had the the saw to cut through that thickness of metal.
Why why did he decide to use like what was
You
going through his
know,
head?
I don't know. I don't know.
And why how do you I don't like I got so many questions
Yeah,
now.
but I was just thinking like maybe he was using, I never thought about it until you just said that, but maybe he was using Cialis or Viagra to kind of as a pump, and that's
Yeah.
why.
Oh, maybe he was just there getting his pump on, had Viagra.
Yeah.
Cute girl
Yeah.
walks by,
Yeah.
and buddy just like, I'm gonna show her what's up and puts the weight clip on his dick and just looks like, I mean, that seems like a very odd situation. I mean, that seems like it's something out of a movie.
What I've learned over the years is that truth is stranger than fiction.
I guess you've seen all kinds of weird stories when it
Well, I
comes to
mean, the thing is
guys.
like fiction is one guy's mind trying to imagine bizarre scenarios, but the truth is like every guy's mind walking around trying to imagine strange
Oh,
scenarios, and some people actually act on them.
that just yeah, it seems so far-fetched. Like I don't understand. I guess it's a thought that's never really crossed my mind, but I mean, if you're taking Viagra at the gym, and again, like I'm telling you, like a lot of bodybuilders take it like during shows like backstage, and that was kind of my fear when I was doing my show, where I was talking to a dude and he's like, "No, man, I took some Viagra before I'm going on stage so I can get a good pump." And I'm like, "You think it's a good idea to go out here almost naked and take Viagra and then go on stage and flex your muscles?" Like I've tried it before, I took enough. I'm like, all right, man, kudos to you. But if you're on stage with a rock hard like boner, I'm pretty sure they're just gonna usher you off and send you to go see a cop for indecent exposure.
Yeah.
It's kind of messed up. But I mean, it is what it is. To each their own. The one question I did have as well was the sweet study. What was that one all about?
So the sweet study was the Shockwave erectile enhancement trial. And so the the goal of that was to try to get a number of offices, and I think we had like 20 plus offices who were pooling all their shockwave therapy results
Okay.
because there'd never been, a large scale multi-site study. But that was an unfortunate
COVID as well.
COVID as well. Yeah.
Well, that kind of sucks. Are you ever thinking about bringing some of these studies back though, now that everything's kind of back to normal?
They're a lot of work. And it's not like I remember it was kind of funny. We we had a guy call the office that wanted to be part of the P-Long study. And I said to him, I said, it looks like you're calling from Ohio. My office is in Northern California. And we had a fair number of people that actually flew in from other places to participate. But
Yeah.
I was like, Ohio's kind of a long way. And he's like, well, isn't it sponsored by the NIH?
What?
And I was like, well, it's listed on clinicaltrials.gov, which is the NIH clinical trials website. I said, but NIH doesn't sponsor studies on penile enhancement. The
Yeah.
NIH is sponsoring studies on like cancer or heart disease, things that are going to kill
Yeah.
people, but they're not sitting around in Bethesda, Maryland, wondering how they can make guys' penises bigger.
It's like I'm pretty sure this is good for the mental
Yeah.
side of
So,
things. So
the funding for penile enhancement studies is not as robust as maybe it could be.
no, that's unfortunate, but I'm pretty sure if we got some big sponsors on board, like maybe Viagra, Cialis, or something, that I mean, just pepper that in along with other studies you may do in the future. Probably have a good sponsor, right? But or Pfizer, I guess even. I mean, they
Maybe.
got all kinds of money.
Yeah. They do.
I mean, a couple multi-billion-dollar lawsuits here, no big deal. So yeah, I'm pretty sure they could fork it out, if it's sponsored by Viagra or whatever the case may be. But I mean, it's good to see that there's changes coming. I guess the other question I had is more of a social kind of side of things. Like, what's it looking like now as far as like the taboo side of things, where people used to be like, "Oh, that's kind of weird." Like, what's your perspective or your take on guys just approaching this more from like, I just want to improve myself? What's your take on, I guess, the social consensus at this point?
Yeah, I mean, men are starting to come around now to actually be more open about taking better care of themselves. Uh, and I think YouTube and podcasts like yourself have helped that. There's good information out there from guys like Peter Attia and Huberman and Ben
Yeah.
Greenfield and and like I said, podcasters like yourself that kind of make that information more accessible so that guys don't actually have to go to the doctor to get, you know, pretty good information. And the thing is, to get healthy, it's not that hard and it's not expensive. You know, if you stop drinking, stop smoking, stop doing drugs, stop eating too much, exercise every day, get enough sleep, stretch, meditate, do some yoga, and be nice to people.
Yeah.
You know, you're going to be healthy.
Yeah. You know, it seems like it's easier said than done though, because I do talk to like a lot of different guys, and it seems like the mental illness side is really starting to like wreak havoc amongst dudes, like as far as like suicide and I feel like there's a lot of different things that kind of tie into it, but I feel like stress is also a major factor there as well, where I feel like we're just tied up as men with like jobs and responsibilities and stuff. But at the same time, I think one of the big things you mentioned there is meditation. That's one of those things that really changed my life for the better, where it's just kind of like grounding myself and, taking that time along with breath work. It used to be woo woo, but now it's just starting to make more sense.
Yeah, I agree with you. I mean, it's a lot easier said than done. You know, like I get pissed off or stressed out or whatever, and I grab ice cream. I mean,
Comfort
like
food.
Ben and Jerry's makes me feel better. It's just,
Yeah.
it's it's not good for me, but fortunately I exercise a lot. I have good genes. So, I'm 15% body fat. I have,
That's solid.
you know, I have a body composition scanner in my office, so I know exactly where I'm at. But and I have an M Sculpt machine in my office, so I use the same technology as the M Cella, but you can use it to build muscle.
Oh,
And
nice.
I was a competitive runner and triathlete, so I mean I that's my leisure time activity. That's what I have fun, but yeah, it's hard.
It is difficult.
Some people want to run away from their problems and they drink or they do drugs or, they get anxious or nervous and they smoke or, they get depressed and they eat too much. It's not easy.
No.
But it's all there.
I mean, the possibilities are endless as far as like, the evolution of men. So I kind of feel like, yes, the odds are kind of stacked against us. However, there's more information now than there ever was. So I kind of feel like a lot of people, like I was listening to a study about a dude talk about, or a podcast about a guy talking about the food industry and Ozempic and this, that, and the other. And he was putting all the blame on the food industry. And I'm like, well, at what point do you say, hey, what can I do myself? Like to just do my best while I'm out here. Like all you got to do really when it comes to food and why I stay in shape and I can get ripped and I do that for my family, my wife and kids is just turn that label onto the other side. Look at the calories, look at the macronutrients, and you're like, okay, cool. It's got a million different ingredients here. Maybe I shouldn't eat this.
Yeah.
Maybe I'll put this down and it's 400 calories for like 100 milliliters. So yeah, I'm just gonna put that away. But I do feel like the onus is on us, right? And that's kind of why I think it's important that guys start taking care of themselves right now. And the last question I wanted to just, get your take and get your feel on it. Where do you see male enhancement as far as like your studies go, the supplements and all that good stuff, the tech? Where do you see that going in like the next 20 years?
Oh gosh, that's a great question. I don't know. I just hope it's done in a way that's safe and in a way that doesn't make other people feel bad or feel inferior or feel the need to do something that could potentially be damaging to them, right? Like I tell
Mm.
people, like, I don't care how big guys' penises are. I really don't, right? But if you decide to do something about it, make sure you're doing it in a way that you can't hurt yourself,
Yeah.
right? Because I've seen so many guys come through my office that have done things where they've hurt themselves like permanently.
Ugh.
And then, they look at you with these sad puppy dog eyes and there's not much you can do. That's the beauty of the P-Long is like you can't hurt yourself. There's only upside. It's only going to cost you some money and some time, but 5 years, 10 years from now, you're not going to regret that you did it. Whereas I've
Yeah.
seen a lot of guys that with a lot of regrets of things that they've done in the past.
Yeah, I've read some of those forum posts, and I mean, the nerve damage, I think, is one that kind of scares the shit out of me, along with, guys that got hard flaccid thrombosis, all kinds of crazy stuff.
Oh
But,
yeah.
or I'm just like, I mean, and again, like, because I looked into male enhancement for myself, and I was kicking it old school with some of these old exercise and stuff, and they did work. But at the same time, I also look back at, all these guys that suffered these incredible injuries from like just stupid shit, though. I'm just
Oh
like,
yeah. I have this one guy, kind of breaks my heart. He's like a totally normal guy, right? And he decided to try to use his friend's trimix,
what's
so
that?
the injection therapy into the penis,
Oh no.
right? For sport. And instead of injecting zero point 0.2, he injected 2, right? He had an erection that lasted 6 days.
Oh my God.
And now his penis is destroyed because when that blood stays in the penis for that long, it gets clotted. And so his penis is totally fibrotic.
The entire thing?
Yeah. Like you want to talk about a Woody, that's a Woody.
That's not a that
Yeah, I mean,
oh
so the
my
thing is like
gosh.
it's just be careful, like
Yeah.
there's a reason that stuff is actually prescribed by doctors who go through 4 years of undergraduate, 4 years of medical school. I went through 6 years of residency. So that's like 14 years of education after high school to be able to prescribe these things.
Yeah. Dear Lord. I couldn't imagine. I mean, what did that even look like when it was done? Like it's just like it's just flaccidly just
Well,
kind of
it's
hanging
like a dried
hard.
up
Like,
sponge.
oh my God.
So anyway, that's just a word of caution
Well,
to your listeners is like, just because
oh God. I
just
mean,
because you have access to it doesn't necessarily mean that you should try
but
it.
that's kind of the scary thing now that you mentioned that too, because I was listening to this guy talking about injecting like I think it was DHT or something directly into his dick, and he was talking about his dick turning into a zombie, and then again, I'm like, bro, like I'm not into that. Like, there's a whole forum dedicated to that. It's called Chemical PE, right? It's on Reddit, and they talk about injecting. I'm like, nah, man, it's not for me, dog.
Yeah.
Like, I'm
Yeah.
not about that. I'll just take the pumping.
Yeah.
I'm gonna take a little bit of Affirm here and there.
Yeah.
Just make sure I get blood flow, baby. I ain't about that life.
Yeah.
Forget that noise. But Dr. Brandeis, this has been awesome, man. Eye-opening as always. And honestly, it's kind of one of those things, or it's one of those conversations that I always take like, hey, you know what? This stuff works, the possibilities out there. However, always proceed with caution. And that's kind of why I thank you for what you're doing. The work you're doing is spectacular. And I'm just excited to see what else you can, what other studies you can come out with when you got more time on your hands. And, if you get sponsored by the NIH, that'd be great, right?
There
But we'll
you
see how
go.
it plays out.
All right, my man. Well, thank you so much for having me on. I really appreciate it.
100%. And I'll put all the links to this, all the links are going to be in the description. Again, anybody wants to get Affirm, get in touch with you. 21st Century Man, also, we talked about that last time. Going to put all those links in the description. And again, the P long study, guys, it's a safe way to go about it. So,
Yeah, just go to p-long.com.
yes, sir. But definitely, I'll put all the links there. Again, thank you for your time, man. I know you're
Hey, my
busy.
pleasure. You got it. Take it
All
easy.
right, perfect. Take care.
Bye-bye.